assisted living world, the communities and the homes that are out there, there's 1,800 homes in Arizona, and there's like 400 communities. It's
about
gone down.
1540.
1540, okay. Assisted living homes, but there's behavioral health homes too.
Okay.
There's DDD homes if you're in that space, but there's assisted living communities. So if you go into a community and you make friends with the admissions person, that's who is talking with the client's POAs at the time of move-in. A lot of agents do bingo with the activities director and little events, birthday events and stuff for the residents, but you're meeting with people that don't make those decisions anymore and have somebody that does make those decisions, and they can talk to you all they want, but they're not going to make a change. And the people who do make the decisions on that already put them in there, have everything in place, and they're working again and they're busy. So they're not going to take time out of their day to talk to you about changing their plan, because maybe you might have a better idea because it's already in place. Everything's in place and it's working. So at the time of entry is when you want to meet them.
You want to get in with the admissions and the nurse that's in the building, because she's usually the one that has to deal with any mobile doctors that are coming in to see the people. And you got to make sure that plan is correct.
So the DON?
Yeah.
Doctor.
The DON, Director of Nursing, or depending upon what their title is in a building.
Okay.
Right? It could be the RCC, which is a Resident Care Coordinator.
So sometimes you want to work with whoever works with outside resources.
Okay.
So an outside resource would be a provider, a doctor, a home health, a hospice, somebody coming into the building, a pharmacy, and that could be the nurse. It could be the activity director. It could be, the admissions person. It could be the executive director. It depends on the building and the structure and the name of the position. Everybody's position names are different. So you want to meet with a marketer or the admissions person, make friends with them. And the marketer's easy because they're marketing. So the way marketers market is they have 10 to 20 places that they visit weekly, that refer weekly and need someone to help them out. So if they're doing it already, like what we're talking about, if they're visiting, 4 a day of the same ones every week, every Monday, the same 4, then we should do that because they're used to do that and they respect that. So that's how marketers in the healthcare work, they visit their referral sources and stop by, drop off pens, cards, coffee or whatever, because they've built a relationship by stopping in every week and saying hi.
And a lot of them co-market together.
Right.
Complementary.
So eventually you get to the point where you could be co-marketing with another rep and getting access to more places than you normally would. Senior healthcare, the communities their marketer's job is to bring in, 10 to 20 new tours a month.
Okay.
So they have turnover too, right? Because people die or people leave. So they need to bring people in. So as a marketer, their job is to bring new people in. Okay. So if you make friends with the marketer, every week you stop by and say hi to the admissions person, the marketer, the admissions person, the marketer. They're working with the POAs. So at the time of move-in is when you say, hey, I can be another arrow in your quiver to meet with these people and make sure their Medicare is current. Because whenever they pull out their card, the family pulls out their card out of their wallet, it's probably old cards. I can cross-check that to see if it's current or if there's a new one in play. And I can see if it's going to work with your mobile providers and your home health providers that come in. If it doesn't work, I can make a change at that point, because when they're new, it gives us a special election period of 63 days to change their plan. Now, if they can't surpass that, then it is what it is. You're stuck with what they have. So how many people come in and they pull their cards out of their wallet and you just take a picture of it and put it in the file? Well, a lot. Well, that's how we do it. Okay, so who double checks that? Well, we really don't double check that. All right, well, I can double check. So then every week you go in there and say, hey, did you get any new move-ins? Do you need me to run their card to see what they have, if their card's good, works with your mobile doctors, or if it's current or if it's up to date? If not, I can change it. Here's my information, let the families know. So every week you go in and you let them know what you do. Because they're not just sitting there waiting for you, and they don't feel rude, that it's rude that you came in every week and offered the same information.